Hi there, my name's Jo Gamble and I'm a functional medicine practitioner. Now today I want to talk to you a bit about autism and the month of Autism Awareness Month, which sadly has gone unnoticed on social media this year because of the harrowing situation of the country, or in fact the world. But for all those people out there that have a child or even a young adult with autism, you know as well as I do that autism doesn't stop for a pandemic. So let me tell you a little bit about my background with regards to autism. I've been working in this field for more than 20 years, initially with a decade of experience as a behavioural therapist specialising in children with autistic spectrum disorder. I then retrained as a functional medicine practitioner, and I've had the great opportunity to integrate both skills together. Now, I wrote for you a booklet all about autism, and I hope that you can do a free download on that. It might give you some takeaway strategies to support your young person or your friend's young person with autism. So, what do we know about autism? Well, first of all, it's one of those umbrella term diagnoses. No two autistic children are the same. And this is one of my criticisms of the way that the healthcare system and even the education system support children with autism. They put them all into one sort of square hole and say, yep, that's where all the autistic children sit. But you know as well as I do, square pegs and round holes do not meet together. So what's my approach to autism? My approach is individualized care. So what are the imbalances in your young person that could be intensifying their symptoms of behavioral dysregulation, of symptoms linked to their gut? Many of the young people I work with autism have lots of gut imbalances, whether that's bloating, distension, wind, constipation. Also thinking about food and maybe food sensitivity. So either they eat the food and they react, or the young person has a reduced ability to widen their diet. They've got a very limited diet. And I know that's not an easy one for us to tackle, but I certainly use my strategies as a behavioural therapist to try to widen their diet back out a bit. So if we think about an individual that's got autism, I want to explain to you the different systems in their body that are likely to be imbalanced, and they are their gut, without a doubt. Thinking about the gut microbiome, and we see the gut as the second brain. So if we want to make changes to our first brain, we have to work through our second brain. I'm next going to think about their neurotransmitters and messages that come around their body that are either excitatory or inhibitory. And quite often in autism, we see a lot more excitatory neurotransmitter signaling and not enough of the inhibitory neurotransmitter signaling. Next, we need to think about the endocrine system and stress response. Many of these children are manifesting stress signals, which might be different to how you and I perceive stress. It might be stress relating to their environment and actually how much of the situation with COVID and being out of their normal routine is actually intensifying their stress response. But they can't verbalize it in the way that you or I might be able to verbalize it. So maybe that's increased their behaviors. Thinking about their liver and detoxification. Many young people with autism have reduced ability to detoxify. And that might be part genetic and part environmental. So I definitely see the liver as part of the process going on in there. We do also need to think about other processes in our body. Some of you might have heard of the terminology methylation. Most of the autistic children that I work with are genetically poor methylators. You may have heard of the acronym MTHFR. And that's something that I can work with your child and understand their genetic abilities or inabilities. And no, we can't change their genes, but what we can do is alter the environment that we bathe them in. So let's almost take the label away and put that to one side. It's absolutely true. The diagnosis is autism, but now let's start to peel them back, a bit like an onion. And we need to go through each layer of that onion to be able to get to the core. And it's once we've got to the core, we might be in a position to make changes that actually could infiltrate through all of those different systems in the body. So I'm sorry that autism awareness has lost their place in social media, that in most years it would have been up there at the forefront. People putting banners over their pictures. I love somebody with autism awareness, and it's gone, but not in my eyes or my heart. This is a condition that requires a multifaceted approach to supporting both the child and their whole families. So please don't think that you lost place in my heart. I am still here to support you and your loved ones, probably now more than ever. So start off with my free download, and if you want more information, please come in and say hi to me, drop me a message, and maybe this is the time that we can start to turn things around. You take care now. Bye-bye.